And we're here today in Sheffield talking about the survivorship programme that's running across South Yorkshire, Bassetlaw and North Derbyshire. Survivorship's not about just care in hospital. It's making sure that when people leave that care that they are provided for, because we're increasingly seeing numbers that are rising and a system that really needs to start to work in a much more integrated approach, and that includes not only sort of physical but psychological, emotional, practical support needs are met for people affected by cancer.
Bringing together clinicians, managers, patients, people who deliver social services. I think it's really important to get everybody together so they can encourage each other, they can share the different ways that they look at things, and they can learn from each other.
We've heard this morning different speakers here today talk about the requirements for holistic care assessment, identifying specific comorbidities that the patient may have. A lot of our patients that access our service actually give us positive feedback. They like the fact that they don't have to attend hospital regularly. They can have that remote care. They feel that there's a nurse at the end of the phone that has the actual time to listen to the queries that the patient may have.
How did you feel here today telling your story?
Slightly nervous. Quite excited. You don't get an opportunity to talk about yourself every day. And I did have a message about physical activity and the importance of that in terms of well-being. I was very open about my breast cancer, and therefore people actually do approach me to talk about it now. So you become your own little sort of social services.
The survivorship program helps me in the sense that it gives me other places where I can actually go for people who is in a similar position as actually living with the disease. There's still a lot of people out there who are isolated, and because of the survivorship and what I know, I actually go out into the community and actually knock on doors and actually encourage other people with the disease to do something with their life. It's about giving them a better quality of life and showing them that they're not on their own.
Well, the project that we're doing is funded by Macmillan. We do work for the NHS, but it's funded by Macmillan. And it's sort of, they're very, very involved. We've had a lot of Macmillan training, sort of trying to incorporate their values, but incorporate the NHS's values as well.
The types of interventions that we've done for patients have been transport, financial, support, emotional, physical, support as well for them.
They trained other cancer survivors, not necessarily with the same diagnosis, I have breast cancer, not bowel cancer, to conduct the research interviews. And I think that's much less intimidating for the patients, much more likely to be honest. It's a much more kind of collaborative conversation, and I thought the training for that was actually also very good.
I made a presentation today looking at the national programme, and it really made me feel I need to update my slides. Things have changed.